Young people in particular are really used to communicating virtually nowadays. For instance, my son thinks nothing of communicating with his cousins halfway around the world using FaceTime. So what we're looking to do is use this absolutely normal way of communicating, but in delivering healthcare.
Connecting with telehealth to children in hospital is a project funded by Health Foundation. It's part of the Innovation for Improvement program, and it specifically looks at what can be done in terms of improving patient care, but also supporting the workforce.
It is aiming to have almost like a video conferencing call with the child, the parent, on their assessment, so of doing their mental health assessment using that link.
The traditional face-to-face communication, which we've always used and thought of as the best way to deliver mental health interventions, is actually very time-consuming. It's very troublesome for patients and their families. My patients often travel over an hour to come and see me. If there's any emergencies that I have to deal with, then they may get cancelled. And, you know, both the parents and the children are taking time off work and school to come to see us.
We've got a hospital in Abergavenny and then a hospital in Newport. We occasionally, not very often, but we might see young people at YYF as well. So yeah, it can involve a lot of travel. Being able to access, you know, telehealth will hopefully make it a lot easier for the families, so they don't have to worry. And also it would reduce the amount of time that we have to travel, which may have a positive knock-on effect in terms of us being able to assess more young people in a working day.
Staying in hospital, if they've come in with anxiety-led problems and stress, then some children it is more detrimental for them to stay in hospital longer. So it actually makes them more poorly.
If a child is admitted on a Friday evening, they won't get seen by the mental health team till Monday. So that is a really, really prolonged time when they don't actually need to be in medically, they're well. But obviously they need to be assessed mentally. If we are able to get them to assess these children quicker on the ward by using the telehealth communication, then we can discharge them quicker.
In the current system, if someone doesn't show up, which is fine, it happens, I can't see somebody else. But if we had telehealth, what I could do is ring someone who's been waiting a long time to see me and say, "Are you free?" So then there's also the potential for increased efficiency.
It also could save time just for the clinicians as well, not just for the patients, so they can do a quick meeting over there. If they've like to have a discussion quickly about a patient before they see them, they can do that also. So there's lots of different benefits to the system.
Attend Anywhere is a specialist software which has been adopted by the NHS, particularly across Scotland. You actually literally have a waiting room that patients go into. In fact, it's even better than our physical waiting rooms because you cannot see the other patients in the waiting room.
When you log on to your Attend Anywhere, you will see your waiting areas. You will be able to see your patients waiting in there and how long they've been waiting for. The patients will be able to access the waiting areas via a link, and only the clinicians then can enter that link on the other side. No data is saved, so no patient data. So it has lots of different safety features.
When we finish our appointment, you leave, and actually the Attend Anywhere does not allow you to come back in again. So again, you can see that it's slightly different from WhatsApp, where you could potentially call me anytime you like. It is a very different system.
We don't envisage this to be something that would be offered to every young person. There are young people who would be deemed inappropriate in view of the risk involved, if they've got past history of, you know, risk and safety issues.
And it's always a choice. It's anybody, the families, young people or staff can say, right, we are not going down this road for this reason. And if they have that choice of choosing, I think they own the decision and they are likely to engage better.
It's also really important that it's not seen as a substitute for human contact. And we are absolutely not saying that we're not going to be in the pediatric wards anymore, that I'm sorry, you're just not going to see us around. And this is absolutely not the message that we're trying to give.
We're very sceptical about it, all of us were. But if CAMHS are saying it's really, really good, then they are the experts in it. They are the ones that are sort of frontline for it's their assessment. So if they feel it's worth a good try, then we'll be for it. And if it cuts down the waiting time for 4 days, 5 days waiting for somebody, which can happen, not very often, but it can happen, then that would be a real, real good thing. That would be fantastic.